hair transplant workshop, and we have 4 doctors from different part of the country we have here with us. And since yesterday we have done the extractions and implantation from the back of the scalp. That's the permanent what? Permanent donor zone, right? So where is the permanent donor zone? Occipital area. Yeah. So we have taken and we have implanted the hairline. And also today morning we have taken about, how many grafts have we taken from morning from the back? 2,500 grafts is what? Grafts are follicular units. Follicular units, right? It is follicular units, like it is in the groups. So we have taken about 2,500 follicular units from the back part. Now we require more. So what is the other donor area? Beard. So today we will be doing the beard. So I have with me Dr. Prajakta, Dr. Siddharth, Dr. Basid and Dr. Raj. So we will understand from them what they have learned from yesterday. But just to start off with, so this part of the neck, the anterior neck and this beard is normally considered as the second donor area, right? So now, like we have the occipital area, first thing is we have to take care of the sensory nerve supply. So we are looking at what? We are looking at the greater occipital, greater occipital, lesser occipital, third occipital. Now we got to anesthetize the whole area, but putting a tumescent here is practically not possible because there is nothing underneath, right? So all we have to do is basically try and anesthetize the whole sensory area. Now I'll mark and show you which are the areas we are looking at. So what you do is basically draw a line along the lower border of the mandible, all the way here, and here, 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 and in the lower border here. So this is going to be our upper extension, okay? And then when we go laterally, go down here like this, go down here like this, and you palpate the thyroid cartilage, go around here, okay? This is going to be our area from where we will be taking the grafts. So if a patient has good amount of donor beard, so we are looking at about 700 plus 800 grafts from here, and if not, maybe 300, 400 if the grafts are. So what's the advantage of taking beard? No. If you take beard and combine it, what's the advantage?
So we get the density of the hair is increased.
Yeah. So this is not an ideal situation for making the hairline because the texture will never match, right? But this gives a very good density. Okay, that's the advantage when you mix it up with your normal, occipital hair area. So now let us understand how do we anesthetize it. So as I had told you, it is supplied by the transverse cervical nerve. Okay, so the transverse cervical nerve normally comes from the posterior part of the sternocleidomastoid, comes like this and goes like this and supplies here. Practically not possible to hit on it. So what we normally do is we give the infiltration anesthesia. Alright. So in this case, what we would also do is he's got a little scarring here. Just an add-on. Why not we just take some grafts here and put it here? Anyway, you are anesthetizing it. Okay. So we will be doing it. So what I will show you now is how to anesthetize this whole area. Okay. And this area. All we have to do is just infiltrate into this area. Stay subacute. Nothing beyond it. Just below the dermis. And we are done. The patient is good enough to go. And then we will be extracting. We will be using a 0.9 mm punch, good enough. The advantage is this follicles or the follicular units are very good. It gives very good density, and you can always combine it. Plus, when you are not taking out a lot of grafts from the back, from the permanent donor zone, the advantage is that you are actually keeping those grafts for future use. So that's one big advantage because he is very young, and most of the patients who come to you for transplant are young. And we know that in androgenetic alopecia, we would require these grafts at a later stage. For sure, after 3 years, 4 years. So we got to keep some grafts for the later. I mean, don't be mean. And if the patient doesn't come to you and he goes to somebody else, he shouldn't say that why everything has been taken. So it's always better to redistribute it at a later stage. Okay? Okay. So what we do is first, viewers, what have you learned since yesterday? How has been the experience? How has been the experience, and what are you looking at for post tomorrow? I mean, tomorrow is again today, the whole day is there, and tomorrow is also there. We still have 1.5 days to go, but then, yeah.
So since yesterday, we started how to give ring block, how to block the main nerve, like trochlear anesthesia, and then we started extractions from the occipital area, the permanent donor zone. The extractions looked quite similar because the graft area was really good for this patient. And then we made slits before we started extracting, and then we did the implantation. And we just covered the hairline yesterday, and today we will be doing more implantations. Today we extracted 2500 follicular units, and
so that's what you have learned. So
yes.
how has been your experience since
The
yesterday?
experience was very good. Very good experience. I feel confident, and sir
Let
has
me help you.
explained.
As a Max Fact surgeon, so why haven't you incorporated this, and what has stopped you now? Are you looking at incorporating this and being the next generation surgeon?
Yes, of course, sir. Of course, sir. And of course, looking forward to extractions with the beard now. And also the non-surgical part we will be learning today and tomorrow.
Yeah.
Is still left.
Pending, yeah.
Lots to learn.
Let's go to Dr. Raj. He's from a rich place called Bhuj. I think one of the only Max Fact surgeons there.
No, there are two or three, not much.
Yeah. But an NRA crowd is what you look for. So, yeah, what has been your experience, and
So it's a day 2 for our workshop, and we have learned. Yesterday we have done a first sitting of the patient, and we have done an extraction of the graft, also slit making and implantation of the graft. And our experience was quite good. Actually, it is laborious work, so it needs too much of technique sensitive also, but still practice makes it a man perfect like that. We have done our best to do for the patient, and right now we are learning how to take the grafts from the beard actually. So it will be a new thing. And there are a lot of videos we can see on the YouTube, but while practicing it was a lot another experience.
true.
Yeah.
I think one thing which you just mentioned is very important. What best can you deliver to the patient? One thing we just mentioned, yeah, that is very important. We all should have, which we all should look at, is what best can we give it to the patient. That is very important. So let's listen from Dr. Basit what he has to say. What has been his experience? He's come all the way from Kerala.
Hi. Yesterday we started from the basics actually, how hair is formed and progenitor. Then later on we came to the patient, we extracted. Initially we made slits, then extracted. Now, actually I'm actually zero from basics I have started. So now I'm confident for doing it on patients. Thank you, sir.
No problem, anytime. Dr. Siddharth is from Nagpur. You can start. So he was with us for our facial cosmetic workshop, and we had a great time. And it is a pleasure to have you here, sir, back again. With an ENT background, getting into hair transplant and cosmetic surgeries, I think it's like really amazing. I mean, you are so busy in your work with ENT, but still you are able to take out time for hair transplant. That's in fact it's really commendable that you want to look forward to something bigger and things like that. So what has been your experience since yesterday, and how do you look forward to yourself?
The experience is great because this is my second training at this center. That itself suggests that the training is superb. So first day was super busy. We did a lot of harvesting and implantation. Second day again we are doing same hands-on training technique. And the day 3 will be the non-surgical modalities of restoring the hair restoration. So it's been a great experience. So we're looking forward for today and tomorrow again.
And doing more and more.
Right.
I am looking forward for you guys to do a lot of
Right.
work and do something good for your patients. That is what I. This is just in the dermis. You have to get the subcute. Yeah. Yeah. Yeah, guys. Thank you so much. And that's how we are doing our training program for the 4 days. For the 3 days hair transplant and hair restoration workshop with all our surgeons around. So let's finish off with this anesthesia, and then probably we'll come back to you guys to show you how we do the extractions in this area. It's a little tricky area to do the extractions here because, as I said, the grafts are. You saw the grafts are all angles. So it's definitely tricky. But then I'm sure we can do a good job, and we will learn to do something much more than what a normal hair transplant is. Yeah. So guys, we'll come back to you in a while to show you how we do the extractions from there. Hello.